Hi everyone, welcome back to PrettyWell. I'm Dr. Angela.
Hi, I'm Dr. Patty.
Today we're going to talk to you about PCOS. We've been doing lots of videos on hormonal concerns lately, and we've been getting questions on PCOS, so we wanted to help everyone learn about PCOS and what it is and how it might present if we have it. So PCOS stands for Polycystic Ovarian Syndrome, and anytime we have a syndrome, it means there's a cluster of symptoms that tend to go into a category. So you don't have to have all of them to get the diagnosis of PCOS, but some of the things that people tend to present with when they have PCOS, sometimes there's disruption with regular periods. So the cycles aren't regular. So too short or not coming at all.
You might not have a period for many, many months.
Exactly. Sometimes, there's pain on the ovaries, and then women will go in and see that they have a lot of little cysts on their ovaries. It doesn't necessarily have to happen, but that's one of the common findings that can happen. Sometimes there are a lot of symptoms like acne happening or dark hair growth, either on the face or in other parts of the body.
Or both.
Absolutely. Sometimes you'll notice issues with gaining weight really easily. Also, maybe there's issues with feeling like you can't regulate your blood sugar well.
Yeah, like you're crashing all the time,
yes.
Or like, you get that jittery feeling like I got to eat something quickly.
Yes, craving sugar a lot, really wanting starchy foods that turn into sugar really regularly. Those are some of the really common symptoms that people will present with when they're struggling with PCOS. Also, sometimes people are trying to get pregnant and they're not able to get pregnant, so their cycles might seem regular, but there's an infertility issue that presents. Those are all some of the things that tend to get people into the doctor's office to figure out what's going on.
So as you can see from hearing the list of symptoms, signs and symptoms from Dr. Angela, it's not like this thing that you have it or you don't, and it has a clear picture and this is what it looks like. You have a broken bone, we've taken an x-ray, it's very clear. It's a little bit more fuzzy, and different people have different symptoms.
Right.
Some people have just one or two, some people have the whole
All
gamut.
of them.
So it's the same thing with testing. Unfortunately, there isn't just one test. There is no PCOS blood test where you go in, take it, and it's a positive or a negative.
Right.
So in order to actually get diagnosed with PCOS, there's several different types of tests that are often done. First would often be just doing an ultrasound. Dr. Angela mentioned that there may be cysts on the ovaries, and that's why it's called polycystic ovarian syndrome. But I have a lot of patients who have PCOS who they've gotten their ultrasounds done and they don't have cysts on their ovaries. So it's not a must-have in order to be diagnosed with PCOS. So beyond ultrasound by your gynecologist or your primary care, beyond the imaging, often blood work is then done, and you would check your blood sugar to see how you're regulating your blood sugar, how high it is. This would be done fasting. Hormones would be checked to see how high your testosterone and DHEA levels are. These are your androgens. And a lot of times with PCOS patients, these will be elevated.
Yeah, these are the hormones that lead to the acne and the dark hair growth.
And then checking to see if you are actually ovulating or not. So sex hormones would be tested as well.
And so the day of, sorry, I was just
gonna say, is there anything I'm missing in terms of blood tests?
No, that's pretty much it. So just a little clarification on the fasting blood sugar is important. And then also there's a test called the hemoglobin A1C that looks at a 4-month window that can be done that helps looking at fasting insulin as well.
It's a little too much science, but it has to do with the speed it takes for your red blood cells to break down. So it looks at 3 months of how your blood sugar has been for the past 3 months. Whereas fasting, I always tell patients, it's whatever's in your blood the minute that needle goes in.
Exactly.
It doesn't look at the patterns of how your blood sugar has been acting.
Right, so you can get a short-term window and a longer-term window in terms of how you've been regulating blood sugar.
So that would be tested as well. And your naturopathic doctor or your integrative doctor may want to look at your adrenal picture. So this is something probably that we would do in our office. You know, it's not like, oh, you have adrenal dysfunction, immediately that leads to PCOS. It's not a one-to-one correlation, but your adrenals have to do with your level of long-term chronic stress, how your body processes that stress, how it's doing. And then it has a trickle-down effect on blood sugar, inflammation, sex hormones. And so it could be one of the contributing factors, causes from, long-term from before just becoming cumulative. So we would want to look at your adrenal picture as well. And funnily enough, we're actually going to do another video on testing your adrenals and what that looks like. So stay tuned for that. But that is something that we would test. And most likely you're going to have to do that with your integrative doctor or your naturopathic doctor. It's not typically done with your gynecologist or MD allopathic primary care physician. So just be aware of that.
That's a great place to start in terms of, just the ultrasound, the pelvic ultrasound or something like that. But just wanting to get kind of a whole picture on what's happening.
And then now you've been diagnosed with PCOS or you're having the symptoms, what to do? Where do we start?
Well, as naturopathic doctors, we often really like to start with the lifestyle pieces. So the first thing I would say is that most women with polycystic ovarian syndrome have difficulty regulating blood sugar. And so this is a place where paying extra attention to diet can be very helpful. And so, really paying attention to make sure that we're having a low glycemic load, low glycemic index when we're eating foods. So this means focusing more on things like green vegetables, healthy fats, healthy proteins, and if you're going to choose to eat fruits, really choosing the lower sugar fruits, things like berries, and then also to be really mindful that a lot of the processed foods, processed flours, turn into sugars very quickly. I feel like this is an area where we get tripped up because it's like, oh, it's a cracker, it's salty, it doesn't taste sweet, but it's something that turns into sugar very rapidly in the body. So just being very mindful of choosing foods that are not going to turn into sugar quickly to help us regulate the blood sugar, and that one piece can help very much with putting things back on track hormonally, regulating our hormones. Because PCOS, just because you have it, doesn't mean that this isn't treatable and that this isn't correctable. It's a syndrome.
Absolutely, absolutely. People move in and out of health pictures all the time. We are organic beings that are, we're not just, this is our picture and it's a snapshot and that's it. So don't be discouraged because, and especially with diet, you are empowered. Like you actually have the power and the ability to make some deep changes through food in your lifestyle, in your health. So nutrition is definitely a huge way that you can do that. And not only cutting out the sugars and the processed foods, but if you can take it one step further, some people have found something like a Whole30 or a very healthy, whole foods based paleo type diet to be helpful in terms of balancing blood sugar and balancing that insulin picture and keeping hormones a little bit more in check. But if that feels too much, cutting out sugars and processed food and processed carbs and refined sugars is a great place to start.
Yeah, it does a lot. Just that one simple little thing can really help shift this predisposition. And so again, along the lifestyle lines, thinking about exercise. So exercise is something that's really going to help sensitize our insulin receptors, which helps us with the blood sugar management piece again. And so there is a link between blood sugar and high androgens. So those of us who are kind of predisposed in this direction, when we eat too much sugar and we have too many carbs, we end up making more of our testosterone and DHEA. So this is kind of that piece in there. And so exercise really is going to help us regulate this. And Dr. Patty has a lot of specific things she was sharing with me earlier.
It's really important to make sure you're doing the right kind of exercise. Now, I've said in videos before, I personally have I don't have PCOS, but I have hormonal imbalances. So it's something that I always have to work on. And I hate exercising. I really do. But it's taken time for me to figure out what works for me. And one of the types of exercise that isn't good for PCOS is, your hardcore hour-long boot camps, spinning, just really what we call steady state cardio or steady state, like running for an hour, that is very stressful to the body. So if you're someone who exercises in that way, you might want to consider switching it up to doing something more long, slow. So that might be a longer walk, hiking, or even a little bit more rigorous or restorative yoga, either one, Pilates, things like that to get your blood and chi flowing, but isn't going to be stressing your hormones. Now, with that said, if you're somebody who really craves that intense workout, what you want to do is just do a HIIT workout. So that stands for high intensity interval training, and you would do 20 minutes or less, and you want to do it so that the intensity is high. So you do it at intervals, a short period of high intensity and a short period of rest or low intensity, and you just go back and forth. And if you've done that for 20 minutes and you're like, oh, that Dr. Patty, that PrettyWell channel, they're steering me wrong, I don't feel like I got a good workout at all, then that just means you can bump up the intensity a little bit more. And actually, you get a better workout because it's more effective and less time. You still get a high intensity workout. You're still sweating. So I would just switch up how you're doing your intense exercise and, alternate maybe with some walking or hiking other days, but making sure not to stress your hormones so much, because what happens is a shorter high intensity interval exercise increases growth hormone. And that's sort of the anti-aging, anti-inflammatory hormone. And when we do steady state cardio, after about 30, 40 minutes, we start to produce more cortisol and more stress hormones. So that's gonna have a trickle down effect on all of our other hormones. So I personally enjoy walking, long, slow walks. And I do find that it really improves my health. It helps with weight management. It helps with, my mind and my nervous system. And I do see an effect. Now, if I were just walking 5 minutes a day, I don't think it would be a huge impact. But if you're someone who never exercises, start with the 5 minutes.
It's a great starting point.
Because that's going to do something for sure.
Yeah.
So beyond lifestyle, diet, and exercise, these are things that you can start right now, right away, as soon as this video is over. What are some actual supplements, nutraceuticals, herbs that we can implement?
Yeah, so we can break these up into different categories, right? Because there's multiple things going on with PCOS. And so one of the areas we need to focus on is if you have high androgens, so high testosterone, DHEA, helping to bring those down. So I like the D-Chiro Inositol quite a bit for helping bring down the androgens. Another area that many women struggle with if they have PCOS is anovulatory cycles, so menstrual cycles where they're not ovulating, or just not being able to make enough progesterone. And so for that category, things like Myoinositol, which helps with the regular ovulation. It helps with stress management too, and so when we deal with stress, we tend to regulate our ovulation.
It helps you ovulate and it helps calm the brain.
Exactly. And then Vitex or chasteberry is another one that really helps with regular ovulation and getting those progesterone levels up. So those for that. And then for the blood sugar category, there's quite a few.
Well, the diet alone is going to make a huge impact. But if you're not seeing enough of a change with that, a few extra nutraceuticals or herbs that you can take are, one is Chromium, and this is going to help with some of those sugar cravings and help with balancing the blood sugar. Gymnema is another herb, and this really helps with sugar cravings, so that's something else that's helpful for that. What am I missing?
Berberine.
Berberine, yes. So berberine is a component of certain herbs, sometimes found in Oregon grape, golden seal, and it has a multitude of wonderful effects, but it definitely helps with balancing blood sugar.
Yeah, so those are some great starting points. Also, there's alpha-lipoic acid, which is an antioxidant, but also helps with blood sugar regulation and sensitizing insulin receptors. So there's many tricks in the bag, and not all of you are going to need all of these things because some people have the whole, picture of symptoms, and some people are only going to have some of them. And so this is really where working with a naturopathic doctor, an integrative doctor, can really help you zero in on which things are going to be the most helpful for you. But this is
Yeah, I was just gonna say often with my patients, I will sometimes incorporate adaptogens into the treatment plan as well. So adaptogens are herbs that help our body process stress and help restore and nourish the adrenals. So if a patient has had a long history of chronic stress or has a hard time kind of processing stress, I'll often test their adrenals and accordingly prescribe different herbs to help manage that portion as well.
Yes, and part of the connection, again, with like the adrenals is the stress piece, and if we're stressed, we don't ovulate regularly, and also if we're stressed and our cortisol levels are off, that can affect blood sugar as well, and so kind of the cycle. So,
and connected to our sex hormones too. And just a little takeaway or sort of little point that we want to make is if you're not ovulating or you're having missed periods or you're gaining weight, it doesn't mean that you have PCOS.
Correct.
There are other reasons why you might not be ovulating. There's other reasons why you might have fatigue, but PCOS is a possible or potential diagnosis, so it would be worth checking out.
Yes. So if you guys have stories of things you have done that have helped to, control the PCOS, stories that you want to share, if you feel like you want to share this video with somebody, please do that.
It was a little bit of a very education focused video, but I think that this could, hopefully some of these things are helpful for you guys, and let us know how it works for you. And if, seek out your naturopathic doctor, your local naturopathic doctor for more assistance and a more individualized, comprehensive treatment plan. But hope you enjoyed this video, and we will see you soon.
Yes, and there's also going to be, information as usual in the description box, so check out there, and we'll see you back here soon. Thanks.